Reports of a diphtheria outbreak in Rano local government area of Kano State have left 50 children dead, raising serious concerns from residents and government alike. Our correspondent Stephen Enoch is in Rano, where he has been speaking with residents, health workers and other stakeholders to establish what is happening on the ground, the circumstances surrounding the reported deaths and responses to the outbreak. Stephen is now live with the latest.
This is Rurum in Rano local government area of Kano State, where 50 people were reported dead. And I'm on the street now. I'm just going to the grave site where some of them were buried, and I got, across some people who thought we were health officials coming to give their children, treatment. I was speaking with one of them whose child died a few days ago. So kagamana ya yarayanka ta mutu.
Alhamdulillah ni yaro ne. Kuma yanda ya mutu da farko dai abin da ya kama shi kamar yanzu an gaya mu. To muka je kemis suka tura mu asibiti aka ba magunguna. Amma da gari ya waye baya iya cin abinci. Kuma an yi kwana 1, 2, 3 sai ga wani ruwa nan ta hancinsa. In ya ci abinci sai ya dawo ta hancinsa. Baya iya cin abinci, baya wani abu. Kuma duk abin da ka bai ta hanci za ka gani. Kaga jini ina zubowa. To kwata-kwata bai fi kwana 7 ba. Gaskiya kawai nan cikinsa ya kama ciwo, bayan nan din baya iya cin abinci, kuma har Allah ya masa rasuwa.
So he said his son actually had that disease, diphtheria, and it happened when he realized that he had the diphtheria disease. He took him to the chemist and they gave him some drugs, and even the drugs they gave him was not sufficient, because after the white substance, got behind his tongue, anytime the child eats, the food comes out through his nose, and at some point the child started having some substance coming out from his nose. He had some high fever, and after 7 days he died. So while we were walking on the road, we saw a man who thought we were health officials, and he brought his children to us thinking that we would give them the drug. So as you can see, this little girl here, she has the diphtheria, and this other little girl here, both of them, they are at the early stage of the disease. So it's something that is very alarming, because almost everywhere you can see children having diphtheria. So Germana yaran kasuna fama da wannan abun.
To ita wannan je ta fara. Wannan kuma sun kuma daga kafa za a yi musu. Amma wannan je ta fara. Yanzu da je asibiti.
All right. So he said that it was just yesterday that they saw symptoms of diphtheria in this little girl, and this other one too is also showing symptoms of diphtheria. Now he's taking her to the hospital. So it's something that is very alarming, and it's something that the government needs to work on, because in this particular local government area, they don't have an isolation center, as we were told when we went to Rano Hospital. So it is something that needs to be addressed at the moment, and it is spreading like wildfire. It is over to you in the studio.
Well, thank you very much, Stephen Enoch, our correspondent there, bringing us some update. We've been following up on this story. Now we're now being joined by Professor Mohammed Adamu, who is the Director General, Kano State Centre for Disease Control. Prof, very good to have you. Good evening.
Good evening. How are you?
Very well. Prof, let us begin with you confirming the exact number of deaths so far, because there seems to be a data gap between the 50 deaths that we have been reporting, stated by the State Assembly, and like the 32 cases confirmed by your agency. Let's begin with that.
Yes, thank you for having me. The Kano State Centre for Disease Control has officials in all local governments of Kano State. The list per local government is having 2 officials. Others could have 3 or 4 of these disease surveillance and notification officers. And one interesting thing is these disease surveillance and notification officers give us daily update of what is happening in their own domain, because they work with people we call surveillance focal persons in the hospitals, like the general hospitals and the primary healthcare centers. And they also work with community informants. They work with community leaders, such as the imams and the traditional leaders. So these people collate information daily and they report to us. Interestingly, when we had the number 50, we still worked with our local government team, beefed them up with the state team to go and find out. What we have on ground is 32 cases from Rano. I was listening to your reporter about the isolation center. Isolation centers are not supposed to be in all local governments. What we have is decentralized diphtheria treatment center, in which the General Hospital Rano is one of them. So the numbers we have from January to August are really 32. 25 of them were mild cases, while 7 of them were severe cases who were taken to the isolation center here in infectious disease.
Where did the figure 50 come from that has been widely spread? Where did that figure come from very quickly?
Yes, we had of the 50 on the floor of the State Assembly. We were not contacted. The Honorable Commissioner of Health was not also in the picture. So when we had 50, we still went down to our own local government officials who went to the local government doing what we call our community active search. We interacted with the community leaders, the Mengwas, and the numbers are still what we have. So we think possibly, we are not asserting, but we think possibly this 50 might have come from people who do not come to hospital. Okay. Because these cases, we had something similar, though on a lesser magnitude in the late days of October 2025. That's precisely 1 year ago. And we realized they had traditional barbers who caught the bull neck of this diphtheria, and we even engaged them in training. So this aspect, thank you.
All right, Professor, very quickly, in 30 seconds, please. Our reporter on ground, the parents there with their kids, said they were going to the hospital. We have 55% of affected patients being zero-dose children. Like, when they do get to the hospital, from that report you saw, what can they see on ground? What are specific field strategies that are being deployed on ground? In 30 seconds, sir.
So whenever we have cases, we are faced with 2 problems. Number 1 is the case management. We manage these patients appropriately, mostly with antibiotics and then other symptomatic care. What we do is we go back to the community where these children come out. We give vaccines, what we call reactive vaccination. So we vaccinate children in that area. Sometimes even adults are given this vaccine. So we do reactive vaccination, and we also give the cases case management. Okay. Thus, we treat them with drugs as appropriate.
All right. Director General, Kano Centre for Disease Control. We've been having that conversation. Professor Mohammed Adamu, thank you for taking out the time this evening to educate us.